Manoj
I would
sir,
like
Thank
to
you. Yeah,
welcome
thank you.
Dr. Neeraj Rayate sir here from Pune. I'd like to say a few words because we had two dignitaries in our total program who are not gynecologists, and he is not a gynecologist, but he will do definitely justice to this today's topic of obesity because he is driving not only surgical management as a laparoscopic and bariatric surgeon, but also conservative management in obesity. Sorry to interrupt. Chairperson, dais is yours. Please go ahead. Thank you.
Thank you. Thank you. First of all, I would like to thank Dr. Shanta Kumar ma'am and Dr. Girish for giving me the opportunity, and Dr. Kiranmai for a wonderful introduction. And I welcome Dr. Neeraj Rayate sir, who is a laparoscopic GI and bariatric surgeon, and he is a gastrointestinal surgeon with expertise in laparoscopy and robotic surgery for GI disease and bariatric surgery. After completing his medical education in India, Dr. Rayate completed his advanced training as a fellow at the Department of GI Surgery at the Athens Medical Center in Greece. Dr. Rayate has special interest in robotic and laparoscopic hernia, GI, and bariatric surgery. Dr. Rayate has co-authored books on minimal invasive and has contributed technical papers to several reputed journals. Dr. Rayate has conducted several live surgical workshops to demonstrate technically demanding procedures, which were broadcast live to international audience in the US, Italy, Turkey, and Singapore. So I welcome Dr. Neeraj Rayate to speak on obesity in adolescents. Welcome, Dr. Rayate.
Thank you, all the dignitaries of Foxy. Without further ado, I would love to start the presentation right away. We'll share my screen. So, an excellent initiative by Foxy, raising happy and healthy children of our country is our primary responsibility. And I must congratulate Foxy for initiating this activity, and it is really going to add immense value for our country. I'm going to speak on adolescent obesity.
we are able to see, sir. We are able to see the slides. Yeah.
Okay. And this is what happened to South Africa when fast food chain reached South Africa. So one major reason of obesity is the changed diet pattern. And we are going to address and understand today what all is likely because of which our younger generation is facing challenges of weight and how we can work on it. So the most important when we consider adolescent obesity is to understand the background, and we must try and dig deep and find out what was the birth weight of an obese child, what was the feeding history, was the child given formula feeds, and was the child was on formula feeds for a prolonged duration. We as Foxy, we are strong promoters of exclusive breast milk, and modification to this philosophy can in long run lead to obesity in our younger population. So also equally important is the family history and how are the other members of the family. So this background is essential for understanding what is happening to our young adolescent kids. So current statistics shows that in a class of 60, fifth standard and above, 15 kids are either overweight or borderline obese. 20 kids have a higher probability of becoming hypertensive, and 6 have a higher chance of becoming diabetic and having other comorbid diseases like cardiovascular diseases, weight-related diseases leading to orthopedic problems. And the most important challenge which kids of adolescent age face is the psychosocial challenge they have to face because of their weight. So why are we discussing adolescent obesity at all? We have to understand this concept of accelerated aging. So anybody who has weight which is excess than the ideal weight looks older to his or her age. And not only they look older, but their physiology and their metabolism also runs like an elderly. So there is a high chance that our generation may have to face the metabolic challenges of our younger generation and shortening of their life expectancy. We all hear news of young deaths and misappropriate lifestyle and weight related challenges are one of the important reasons of shortened lives in the younger population. So also with increasing weight is the bigger challenge of quality of life. So here is a choice for all of us and the listeners of this talk. What do we want as for our children and for themselves? So to define adolescent obesity, body mass index has to be more than 30 to 35 kgs per meter square. With extreme obesity, we have seen candidates having body mass index more than 35 kgs per meter square. Usually they also have associated comorbidities like diabetes, obstructive sleep apnea. And yes, it is true. Even kids of age 15 can have these comorbidities. Broadly, we have to divide these kids into two broad age groups: those who are before achieving their important lifestyle milestones and those who have completed their milestones. So also we can divide them into obese kids or kids who do not have much of serious associated comorbidities and kids who have serious associated comorbidities. So there is a list of associated complications when it comes to childhood obesity. I don't want to threaten everybody by enlisting these problems because they are usually seen in morbid obesity. But what I want to really focus on is there is huge number of population which is not morbid but obese and which we have to address and help them live a better life. So broadly speaking, we have two generations here. Our generation, which we can say earlier generation, and in our adolescence we had less processed food, hardly any technology at our hand, good amount of physical activity and lesser lifestyle stress. While if we compare ourselves to the current generation adolescents, I don't want to be judgmental, but access to instant food is far, far more. Technology is ruining the younger generation life. There is hardly any physical activity which is seen, and peer pressure and competitive pressure and social media pressure are adding enormously to their lifestyle stress. But yes, there is a good news. Weight loss in young age is definitely easier. If you see people of our age, if we are obese, we are already associated comorbidities. And that's why in adults, the weight loss is challenging, but in younger population, the weight loss is definitely possible and easier. And I will show you the case examples by which you can understand, yes, it is possible. So this is my request to everybody who is listening to this talk. Can you write in the chat box what you all can see? I'm sharing images with you and I want all of you to share your thoughts. What is you are seeing as a first glance in this image? Can I see some responses? Exercise and laziness is one answer. Luxury versus exercise is the other. Cycle but upgraded, great. Very interesting inputs. cycle and exercise? So yes, when we see this picture, there is a possibility that a good amount of us can see the car, and that is what is telling us what are we thinking in our mind. So on one side we have a bicycle, and on one side we have a high-tech car, and what grabs our mind tells us what are we built in, or what are we are these days built in for, because of the pressures which are coming in our life. And the next slide is more interesting. Please continue sharing your thoughts and chats. What do you see in this slide? Yes, what do you see in this slide? Please send me the inputs. Superb. I'm really happy with some of the answers. One answer is mountains. That's basically anything else? Nature and junk. Beautiful. Fast food. Yes. Mountains should be overlooked with burger in front. So when I saw this picture first, what hit me fast was the MACD. So many times we lose the importance of the big picture of mountains on the front of MACD, and that is what is happening to our day-to-day life. I really congratulate all those who have written mountains and bicycle in their chat box, and that proves that they are really healthy in their mindset, and their outlook is really proactive towards health. So let's move further. So what is the role of exercise? You know, when people try and think about weight loss, they first think of curtailing their calories. So here is an important quote which I want to share with all of you. Diet decides weight, but exercise decides shape. It is easier to diet than is to exercise. We don't need much of mathematics. When it comes to exercise, we have to be really understanding what is the science, what is the amount of energy, what is the amount of effort. So here is my humble request to all the parents who are listening to my talk. Children who are in the obese adolescent group, please don't starve them. They are in the growing age, and stopping them eat is not the solution. Making them eat right things and making them exercise is the right solution. So best exercise for preventing and treating child obesity for all the parents who are listening to this lecture is the amount of time the child is giving to the class has to be the amount of time the child has to give for his or her physical fitness. So do send your child to play for at least an hour every day. Let it be structured or unstructured sport, but jitna time tuition, utna time khelna. Kids who are listening to this talk can give this back to their parents. If the parents insist on tuition, they have to tell their parents, jitna time tuition, please grant me utna time khelna. So we have to understand one important hormone which is secreted in our body, endorphin. We all know about endorphins, and in the olden days, I'm saying olden days, it's true today also, all those who do regular exercise, who do sports, who do creative achievements, they have that endorphin secretion. The similar endorphin secretion is equally there when there is instant gratification of like, when there is instant gratification of share, when there is instant gratification of appreciation. So we have to understand which kind of endorphin we are seeking, whether we are seeking the endorphin of physical activity or whether we are seeking the endorphin or social activity. If you ask me, avoid the social media endorphin, and have the real social network, the real Facebook. Now that is what is going to really change the life when it comes to weight loss. So what are the treatment options when it comes to excess weight in adolescence? First and foremost is that we have to rule out that there are no associated hormonal disorders. The easiest way for parents to understand whether our child is obese or not is by watching their clavicles. If their clavicles are visible, rest assured that they are not obese. If you can count ribs of your kids, they are not obese. If you can see their elbow, they are not obese. So these are some simple tricks by which you can understand. But as parents, we have to accept whether our child is obese or not. By gauging these ways, we can understand whether our child is obese or not. Now, once we are aware that our child is obese, then what needs to change is not the diet of the child, but the family diet. Each and every member of the family, irrespective of whether they are excess in their weight or not, have to be with the child when it comes to the process of weight loss and follow the same diet which your child is following. There has to be a family exercise time. Ask yourself, and where do you spend your weekends? If you are spending your weekends in malls, then we are heading towards adolescent obesity. If we are spending our weekends at outskirts, then be happy about what we are living. Well, with all these measures, if we are not achieving weight loss, we have to think about intervention, and preferably these interventions should be reversible interventions. So gastric balloon or a reversible bariatric surgery are the options which can be considered if non-interventional measures of lifestyle modification, diet, and exercise do not work for our kid. So weight maintenance for our life and no medicines for life should be the goals our child as well as we should have. So here are 3 case studies which I am going to share with you. These are case studies of childhood obesity, and I am going to share the interventions which we did. Broadly, whenever we are presented with kids which are obese, we try and understand whether these kids are only obese because of the lifestyle challenges or they also possess comorbidities because of their obesity. If they are only obese but healthy, lifestyle intervention will definitely work on them. If they are obese with comorbidities, some or other they are going to need intervention in form of either a balloon or a surgery. So here is first case. A 10-year-old girl who was presented to us with weight of 86 without any comorbidities, whose height was only 156 centimeters. After 6 months of lifestyle intervention in the form of diet and exercise, this is the change we could achieve in her. A loss of 6 kgs weight, and that is something you can see how her form has changed because active exercise was added to the kid's life. Here is a second example of a boy who was 12-year-old, was fond of sports, but the sports which he was playing was more related to also diet. His weight was 88 kgs and his height was 170 centimeters. And 1 year down the line, after the intervention, you can see the significant change in the child, around a 1 kg weight loss per month, having lost around 13 kgs in a year's time. He was a child of a pediatrician, and I'm happy to say that the active support from the family is what brought this change in the child. Every child may not be as lucky as these 2 childs. And some important concerns which we have to understand are the associated comorbidities along with obesity. If we face with these challenges, like this case, who was a 17-year female having hirsutism, acanthosis nigricans, and polycystic ovarian disease, after failed lifestyle modification, only option which was remaining was gastric balloon in the form of intervention. So this is a daycare procedure where endoscopically a silicone balloon is placed inside the stomach under general anesthesia, and this leads to weight loss over a period of 6 months. This is an inflated balloon which is filled with normal saline to the capacity of around 350 to 500 ml, and it's a daycare procedure. The most important advantage that this balloon is removed at the end of 6 months to 1 year, and that's why it's a completely reversible procedure. So we can achieve weight loss in the range of around 10 to 25 kgs at the end of 6 months to 1 year based on the compliance from the patient. But the success also requires highly motivated patient where we play a role in supporting them in diet and exercise. The common side effect of this procedure is initial few days of nausea and spasmodic abdominal pain, which resolves over a period of few days. So this is the pre and post picture of the same child. You can see a 17-year-old girl, how old she looks and what is the kind of transformation she has undergone after the endoscopic gastric balloon. So to sum up, surgical intervention does have a role in the right patients when there is failure of medical and lifestyle management. Weight maintenance than weight loss should be the goal after the weight loss. Timing of intervention with respect to puberty is very critical and crucial, and reversible procedures should be the procedures of choice when it comes to weight loss. Thank you so much, Dr. Nilesh, for giving me this platform. Thank you so much, Foxy, for giving me this opportunity to share my knowledge with each and everyone.
Thank you, Dr. Rayate.